Hello, dear learners. Welcome to Exploring an Understanding of How Research Supports Yoga for Mental Health. Let's set forth on a journey of exploration, gently weaving the threads of research into the fabric of our own knowledge and skills. So, whether you're a therapist, a teacher, or simply a seeker of knowledge, I invite you to embrace these moments with a sense of gentle curiosity and openness. I'm your host, Judy Thompson, and in today's segment, we'll be exploring the publication, Effectiveness of Trauma-Informed Care Implementation in Healthcare Settings, Systematic Review of Reviews and Realist Synthesis, published March 2024 in the journal, the Permanente Journal, authored by Ellen Goldstein, Binny Chokshi, G.J. Melendez-Torres, Anna Rios, Martina Jelly, and Annie Lewis O'Connor. In this episode, we will be exploring a comprehensive research paper which investigates the implementation mechanisms and outcomes of trauma-informed care across diverse healthcare systems. This paper leverages a systematic review and realist synthesis methodology to provide an understanding of how trauma-informed care can be effectively integrated into health services. We'll also consider how trauma-informed care is not just a treatment modality, but a transformative framework that aims to create safe and supportive environments for both patients and healthcare providers. We will review the key findings from the study, which provides insight into effective strategies and practices that have been shown to improve outcomes when implementing trauma-informed care. We will also consider how these findings align with the Substance Abuse and Mental Health Services Administration's SAMHSA's 10 implementation domains, offering a structured framework for organizations to follow. Sustaining trauma-informed care practices requires dedicated leadership, resource allocation, and a commitment to continuous learning and adaptation. The principles of trauma-informed care include understanding trauma's pervasive impact, recognizing the signs and symptoms in patients and clients, integrating knowledge of trauma into practice, and actively working to not cause re-traumatization. Given the widespread impact of traumatic exposures and their profound effects on health, there's a critical need for healthcare systems to adopt a trauma-informed approach. This not only ensures better care for patients with trauma histories, but also improves overall healthcare outcomes and efficiency. The research paper examines trauma-informed care implementation in different healthcare systems. By utilizing a systematic review and realist synthesis approach, the authors aim to develop a comprehensive understanding of how trauma-informed care can be effectively integrated into health systems. Trauma-informed care is a critical approach designed to improve how healthcare systems interact with individuals who have experienced trauma. Given that trauma can have a profound and lasting impact on an individual's mental, physical, social, and emotional well-being, trauma-informed care emphasizes recognizing the signs and symptoms of trauma, responding appropriately, and actively working to prevent re-traumatization. The authors of this paper conducted a broad systematic search through multiple databases, including Medline, Embase, PsycInfo, CINAHL, and the Applied Social Science Index and abstracts. They focused on reviews published within the last decade to ensure that the data and insights presented were both current and relevant. By employing realist synthesis methodology, the researchers aim to explore not just whether trauma-informed care works, but also how and why it is effective in various contexts. Unlike traditional systematic reviews that typically confirm whether an intervention is effective, realist synthesis seeks to explain the mechanisms by which trauma-informed care succeeds, accounting for the complexities of varied healthcare environments. The paper included 16 significant articles, each contributing insights into the strategies and outcomes of trauma-informed care implementation. These articles were examined to identify and understanding patterns and common strategies that lead to successful trauma-informed care implementation. A crucial aspect of this research is its use of the Substance Abuse and Mental Health Services Administration's SAMHSA 10 trauma-informed care implementation domains as a guiding framework. These domains encompass areas such as engagement and involvement, training and workforce development, cross-sector collaboration, screening, assessment, and treatment services, governance and leadership, policies, physical environment, progress monitoring and quality assurance, financing and evaluation. The findings show that implementing trauma-informed care effectively requires engaging patients, clients, and staff through collaborative trauma training, comprehensive trauma education, and supportive leadership. This systematic approach demonstrated that a trauma-informed strategy not only benefits the patients and clients by enhancing their safety and overall care experience, but also positively impacts healthcare staff, reducing burnout and improving job satisfaction. Overall, this research paper highlights the importance of a methodical and scientific approach in understanding and implementing trauma-informed care across healthcare systems. It provides a structured yet flexible framework that healthcare organizations can adapt to fit their specific needs, ensuring a trauma-informed environment that fosters healing and resilience for all individuals involved. Trauma-informed care is a vital approach in healthcare settings. It acknowledges trauma's broad impact and how it affects people's mental, physical, and emotional health. At its core, trauma-informed care seeks to understand, recognize, and respond to the effects of all types of trauma, aiming to provide care that promotes safety and healing while actively working to avoid re-traumatization. The Substance Abuse and Mental Health Services Administration, or SAMHSA, provides a comprehensive definition of trauma. They describe it as an event or series of events that is physically or emotionally harmful or life-threatening, with lasting adverse effects on an individual's functioning and overall well-being. This definition highlights how common traumatic experiences are, showing that almost 90% of U.S. adults say they've faced at least one traumatic event during their lives. The effects of these events are not limited to immediate reactions, but often extend to long-term health complications, both physical and mental. The goals of trauma-informed care are multifaceted and deeply interwoven with the principles of safety, trustworthiness, peer support, collaboration, empowerment, and cultural respect. The primary aim is to create an environment where patients and clients feel safe and supported, thereby enhancing their ability to recover and thrive. A trauma-informed approach within healthcare systems involves recognizing the signs and symptoms of trauma in patients, families, and staff members, integrating knowledge about trauma into policies and practices, and striving to avoid re-traumatization at all costs. One of the critical needs in the implementation of trauma-informed care is robust systems-level data. This data is vital for demonstrating the effectiveness of trauma-informed care approaches in achieving desired health outcomes, maintaining high standards of care, and ensuring sustainability of these practices across diverse healthcare settings. Systems-level data can help identify best practices, measure the cost-effectiveness of trauma-informed care, and ensure that trauma-informed approaches are tailored to meet the needs of particular populations within the healthcare system. Research has shown that trauma-informed care significantly contributes to promoting safety and preventing re-traumatization. Re-traumatization can occur when healthcare interactions trigger memories of past trauma, leading to heightened stress responses and exacerbating mental and physical health issues. Trauma-informed care aims to create healthcare environments where such triggers are minimized and patients are treated with increased sensitivity to their past experiences. To achieve its objectives, trauma-informed care necessitates changes at multiple levels within healthcare institutions. It involves training all staff members, from administrative to clinical, to understand the effects of trauma and adopt practices that promote healing and safety. This training includes recognizing the signs of trauma, understanding the pathways to recovery, and implementing strategies to support trauma survivors effectively. Moreover, trauma-informed care focuses on fostering a culture of safety and trust within healthcare settings. This involves clear communication, maintaining patient dignity and privacy, and ensuring that care is collaborative and empowering. For example, allowing patients to have a say in their treatment plans and ensuring they fully understand their care options are fundamental aspects of trauma-informed care. By doing so, patients and clients are more likely to feel validated and respected, which can significantly improve their overall health outcomes. Trauma-informed care represents a paradigm shift in how healthcare is delivered. It requires a deep commitment from healthcare organizations to rethink traditional methods and embrace practices that prioritize the holistic well-being of patients. As research continues to shed light on the long-term benefits of trauma-informed care, it becomes increasingly clear that implementing these principles is not merely an option, but a necessity for modern healthcare systems seeking to provide the highest quality of care. Realist synthesis methodology played an important role in this study. Unlike traditional systematic reviews that focus on whether an intervention works, realist synthesis aims to understand the mechanisms behind the intervention's success in varying contexts. It's an explanatory approach that seeks to uncover why and how an intervention produces its outcomes. The researchers devised context mechanism outcome configurations to provide clear explanations for the findings. The reviewers then used thematic analysis to create a model explaining trauma-informed care implementation in various healthcare settings. The findings were mapped onto SAMHSA's 10 trauma-informed care implementation domains, providing a vivid framework for understanding the effective strategies and their outcomes. The domains include foundational aspects such as engagement and involvement, training and workforce development, cross-sector collaboration, screening, assessment and treatment services, governance and leadership, policy, evaluation, progress monitoring and quality assurance, financing, and the physical environment. The thorough and systematic approach taken by the researchers exemplifies the rigors of high-quality scientific inquiry, provides a solid foundation for the study's findings, and contributes significantly to the existing body of knowledge on trauma-informed care. So we understand that the researchers mapped their findings to SAMHSA's 10 implementation domains, offering useful insights. Let's analyze these components to determine what makes trauma-informed care successful. First, engagement and involvement have been identified as critical. Successful trauma-informed care implementation actively involves service users in all aspects of the organization's functioning and planning. This includes integrating the lived experiences of patients and clients and their families into treatment processes and ensuring their voices are heard. By doing so, emotional safety within patient-staff relationships is significantly enhanced, leading to better care outcomes. Moving on to training and workforce development, the study highlights that equipping all levels of staff with proper training on trauma-informed care principles is essential. This includes understanding the neurobiology of trauma, recognizing trauma symptoms, and providing ongoing support and supervision. When staff members are well trained and supported, they are more empathetic and effective, which translates into improved patient and client care and reduced re-traumatization. Cross-sector collaboration is another domain that stands out. Interprofessional collaboration and partnerships with community organizations help create a comprehensive and coordinated support system for patients and clients. This approach addresses not only the healthcare aspects, but also the social determinants of health, such as housing and food security, which are vital for holistic care. In terms of screening, assessment, and treatment services, the study underscores the importance of trauma-informed procedures. For instance, allowing patients and clients more control over their clinical encounters and minimizing the need for them to repeat their traumatic experiences fosters a sense of safety and trust. Implementing evidence-based, trauma-informed treatments and ensuring these are culturally appropriate further enhance patient and client outcomes. Governance and leadership play a pivotal role as well. Senior leaders' commitment, through the allocation of resources and clear support, is crucial for sustaining trauma-informed care initiatives. When leaders prioritize trauma-informed care, it fosters a culture shift within the organization, ensuring that trauma-informed practices are embedded at all levels. Policy alignment is also key. Policies and protocols that integrate trauma-informed care principles ensure a consistent approach throughout the organization. Flexible policies that accommodate patient and client needs and preferences can significantly improve patient engagement and reduce re-traumatization. Evaluation and continuous quality improvement are imperative for monitoring the impact of trauma-informed care implementation. Regular assessments and the use of real-time data help organizations adapt and improve their practices continuously. This ongoing evaluation ensures that trauma-informed care practices remain effective and are refined over time based on feedback and outcomes. Additionally, the study identifies the financial aspect as a critical enabler. Adequate funding and resource allocation are necessary to support the long-term implementation and sustainability of trauma-informed care. Investing in trauma-informed care may have upfront costs, but the long-term benefits, including improved patient and client outcomes and reduced healthcare costs, make it a worthwhile investment. To summarize, the key findings of this study highlight that successful trauma-informed care implementation requires active engagement and involvement, comprehensive training of all staff levels, cross-sector collaboration, trauma-informed procedures, strong leadership and governance, policy alignment, continuous evaluation, and appropriate financing. These strategies collectively contribute to a trauma-informed approach that not only benefits patients and clients, but also enhances the overall healthcare system's efficiency and effectiveness. Integrating these findings into practice can lead to significant improvements in both patient and client and staff experiences, which helps to foster a more compassionate and supportive healthcare environment. While we've examined the key findings of the study, it's essential to discuss the broader implications and the steps that need to be taken to sustain trauma-informed care practices in healthcare settings. This study's findings emphasize three main pillars for the effective implementation of trauma-informed care: policy, education, and research. First, let's discuss the importance of policy. Effective policy frameworks are critical as they shape the structural foundation of how trauma-informed care can be integrated within healthcare organizations. Policies that prioritize trauma-informed care must be standardized, well-documented, and consistently communicated to all levels of the organization. Senior leadership plays a vital role here. Their endorsement and active participation in trauma-informed care initiatives ensure that the required resources, financial, human, and operational, are allocated effectively. The support and commitment from top leadership are essential for the sustainability of these practices. For example, policies could include trauma-informed principles in mission and vision statements, ensuring that every member of the organization from the highest to the frontline staff is committed to these ideals. Second, education and continuous workforce development are essential. The study underscores the necessity of ongoing education that enhances skills and improves knowledge related to the impact of trauma on health. This includes training for all staff members, not just clinicians, but also administrative personnel. Training should cover the fundamentals of trauma, its effects on both patients and staff, and practical interventions that reduce re-traumatization. For instance, staff training sessions should be experiential, fostering an environment where employees can practice trauma-informed approaches in real-life scenarios. Importantly, this training should be a routine part of professional development and supported by continuous coaching and supervision to sustain the skills acquired. And additionally, research is a cornerstone for the continued growth and validation of trauma-informed care practices. More studies are needed to build a robust evidence base that supports trauma-informed care implementation. This involves research not only on immediate clinical outcomes, but also on long-term benefits such as cost-effectiveness, reduced staff turnover, and improved patient satisfaction. Future research should aim to refine trauma-informed care strategies to meet the needs of diverse populations in different healthcare settings, develop metrics to assess the impact of trauma-informed care interventions, and it should also explore new approaches that can enhance the effectiveness of these practices. It is important to consider the integration of trauma-informed care with health equity approaches to address the disparities experienced by marginalized groups. A comprehensive strategy can help ensure more effective and compassionate healthcare delivery for all populations. Looking ahead, future directions for trauma-informed care research should focus on evaluating the implementation processes and outcomes, as well as understanding how positive experiences and resilience can be incorporated into trauma-informed care frameworks. This approach addresses trauma while using personal strengths and community support. Moreover, the research component should aim to develop more comprehensive models that integrate trauma-informed care across various sectors, beyond healthcare to include education, justice, and social services, thereby creating a more holistic and coordinated support system for individuals affected by trauma. In summary, the study highlights that for trauma-informed care to be effectively implemented and sustained, there must be a strong policy framework, continuous education and training for all staff, and a commitment to ongoing research. These elements are essential to create a safe and supportive environment for patients, clients, and healthcare providers. As progress is made, it is crucial that we advocate for these practices, ensuring they become an integrated part of our healthcare system. Let's take a moment to reflect on the key points we've covered today. We've reviewed research on the importance and effectiveness of trauma-informed care in healthcare settings. Through a comprehensive systematic review and realist synthesis methodology, the study highlighted various strategies and outcomes that can successfully implement trauma-informed care across diverse health systems. In understanding the purpose and significance of trauma-informed care, we explored its primary goals, promoting safety within healthcare environments, preventing re-traumatization, and fostering healing and recovery. The need for systems-level data emerged as a crucial element to support and validate the practices of trauma-informed care, allowing for more widespread and effective implementation. We explored the methods used in the study, from the systematic search of multidisciplinary databases to the detailed examination and synthesis of relevant reviews. These efforts resulted in creating a strong framework that matches SAMHSA's 10 trauma-informed care implementation areas, a tool organizations can use to assess their readiness and ability for system-wide change. Key findings of the study underscored the strategies and interventions that lead to improved outcomes for patients, clients, and also healthcare systems. By engaging patients, clients, and families into care planning, by providing staff training, and by fostering cross-sector collaboration, these strategies showcased how trauma-informed care can be operationalized successfully. The results underscored the importance of leadership support, policy alignment, and ongoing evaluation to sustain these beneficial changes. The broader discussion emphasized the crucial role of policy, continuous education, and research in ensuring the longevity and effectiveness of trauma-informed care practices. Future directions highlighted the need for further research to fill the existing evidence gaps, consistent policy support, and ongoing education programs tailored to the needs of healthcare providers. Trauma-informed care isn't just helpful, it's truly vital in healthcare settings. This caring approach brings about positive changes that go hand in hand with boosting health equity and supporting patients, clients, and healthcare team members. By recognizing and caring for the widespread effects of trauma, we can build kinder, more secure, and more successful healthcare settings for all. Whether you are a healthcare provider, policymaker, or community member, your voice and actions can contribute to advancing these practices and supporting those affected by trauma. How can you effectively advocate for trauma-informed care practices within your own sphere of influence? What steps can you take to promote this important approach to care? Keep promoting trauma-informed care in your field, ensuring it becomes a core component of healthcare practices. Thank you to the authors and publisher for all of the research within this important study, Effectiveness of Trauma-Informed Care Implementation in Healthcare Settings, Systematic Review of Reviews and Realist Synthesis. For those eager to continue exploring or for anyone seeking more in-depth information, additional resources and supplementary materials can be accessed within the links provided in the episode description. As we end our time together, remember to embrace and witness the beauty of life, and within shared experience, Be the thread that creates compassion and curiosity for others. Thank you for joining me on this journey in learning how research supports yoga and integrative practices for mental health and well-being. May you find and share beauty and peace on your journey toward wellness.